Let's shine by seeing the best in all of us and by looking out for each other. Let's stay healthy. Let's shine together.
Hi, I'm Sherry Harlan, program host for Let's Talk Together. And today we are going to discuss Minority Mental Health Month. And our guests today are Barbie Will
Hi, Sherry.
and Trina McCall, and they are both with Reid Health Outpatient, behavioral health.
Yes.
Let me correct that.
I say it's a long title, Sherry, so I totally understand. Like sometimes I get tripped up.
So, and welcome to you both. And what can, before we get started, tell us a little bit about yourselves.
Sure.
Okay. Sherry, I'm Trina McCall. I'm the practice manager of Outpatient Behavioral Health. I've been with Reid for 14 years. I actually started out on the inpatient side as a behavioral tech, and then I moved to outpatient about 6 years after being on the inpatient side. I definitely wanted to be a part of Reid. I had an interaction when my father was in the hospital due to an illness, and being a family member, you come with concerns and want to make sure that your family's getting the best care ever. And so just him being in that place and me being with him, I saw how the doctors and the staff and everybody was very welcome and very concerned. And, you know, they came to me and gave me the information I needed, and I felt like he was being well taken care of. And so Reid put that out there in the community to definitely be a part of that. So I wanted to work with something that was bigger than myself. And so I've been with Reid ever since.
Oh, great. We're happy to have you here.
Happy to be here.
And Barbie, you're no stranger to Let's Talk Together.
I was saying, like, that's such an admirable reason to, like, come to Reid. So for Trina, I love that story. But so I came to Reid. This year will be my 5th year. I'm super excited. So I actually came to Reid. April Coffin, who is the director of Outpatient Behavioral Health, she approached me. We were working a different job, and she had approached me and was like, I think you would love our patient population. She's like, I think our patient population would love you. And I was like, well, tell me more about what it's like working at Reid. And she just shared with me all of the great things that Reid does for the community. I loved the vision of Reid, like wanting to be there to support the community, really uplift the community, really focus on our community's health. And with everything that April was sharing with me, I was like, I can't pass up this opportunity. And then, of course, like she talked about how great the staff were, and I was like, okay, let me try it out. So, and I have not regretted that decision for a single day. I love being here at Reid. I love, you know, our staff in outpatient behavioral health, and I love Reid as a whole.
Well, thank you. And we are really happy that you're here as well. And also, we have to thank April for her visit.
Definitely.
So as we get started, I just wanted to read a little something on my National Minority Mental Health Awareness Month.
Sure.
And actually, it started with B.B. Moore Campbell. And one of the things she had written about was, once my loved ones accepted their diagnosis, healing began for the entire family. But it took too long. It took years. Can't we as a nation begin to speed up that process? We need a national campaign to destigmatize mental illness, especially one targeted toward African Americans. It's not shameful to have a mental illness. Get treatment, recovery is possible.
Yeah.
And from that, I'd like to hear some of your input on what do you think some of the reasons it's important to focus on mental health, especially within minority communities.
Sure. So just to kind of piggyback off of what you were talking about as far as BB Moore Campbell, she was an amazing advocate. And like little fun fact, she and I actually share a birthday. So we're both Aquarius babies. But BB Moore Campbell, she did so much to advocate for mental health. And I mean, she was just like an all-around very active person. She was an author. She wrote books about the harmful impact of racism. She wrote books about the stigma related to mental illness. She was a journalist. She was a spokesperson. She even co-founded the Urban Los Angeles branch of NAMI, which is the National Alliance for Mental Illness. And so she actually passed away in 2006. And in order to honor her and all of the advocacy work that she did for mental illness, the House of Representatives in 2008 decided that July would be known as the BB Moore Campbell Minority Mental Health Awareness Month. And so she is credited for all of the work that she's done. I mean, she really did advocate not only for minorities, but just like better access to mental health care for everyone. You know, she wanted to put out there education for mental health, support for mental health, making sure that everybody had access, because like you were just reading, you know, sometimes, you know, the access isn't always there, and then we end up having situations where people don't get it in time. Or, you know, it's a long history of trauma before, and then it makes it that much more difficult to overcome. So I definitely applaud her and all of her efforts, and I'm you know, very grateful that, you know, we do have this Minority Mental Health Awareness Month, because, you know, like it's so important to talk about mental health, especially in minority groups, because our mental health impacts so much of just our overall well-being. Like there's different areas. I mean, when we think about mental health, we're talking about it impacting how we think, how we feel, how we behave. You know, it impacts our physical well-being. I think back in May when we just did the Mental Health Awareness Month, we talked about, you know, like mental health having implications for our physical health that, I mean, are just as serious as smoking or obesity. You know, it also impacts our relationships, it impacts work, it impacts school, you know, it impacts how we deal with the difficulties in our lives, it impacts how we deal with change. And so if we're not focused on our mental health, then it makes it more difficult to be healthy in our responses to all of those different stressors. And so, you know, focusing on our mental health makes us just healthier people overall.
Then, so what are some of the things that can negatively or positively impact on mental health?
I can speak to that, Sherry. Thank you for
Okay.
that question. So I would say I would like to add to what she said as far as the physical health. Physically, if we feel well, mentally we feel well. So taking care of our bodies, eating correctly. Social media, we know we're all part of technology right now, so social media, I believe, plays a big part of our mental health, with some positive being, you know, you can, there's things you can do now where you can be added to groups. Certain groups are something that is a hobby that you would like to take on that helps you in your pastime to get through some things. You have a group of people who align with you when it comes to that. Some of the negative pull away from that could definitely be you're putting yourself in comparison to other people's lives. We like to take pictures of our families and go on vacations and do things of that nature, and then if other people are viewing that, they're looking at why they can't be in that space to do those simple things that's like that. Family and friends, it's very important to have family and friends around, definitely when you're needing the support, to have someone to talk to. And then a negative from that could be sometimes we're not comfortable having those conversations to resolve our pains and our traumas and things that we're going to, because we feel that our family may judge us. So there's give and take when it definitely comes to those, but there's always positive and negatives in both those things.
I think it just came to me and I was wondering, when we look at often you can say, oh, I saw them on social media. They look like they have a fabulous life.
Yes.
Yes.
My life sucks.
I was
So,
gonna say that's definitely like one of the like phenomena that we're dealing with now is like that whole idea of FOMO, like the fear of missing out.
Yep.
And because we can be very comparative, especially when we're struggling with loneliness, especially like if we feel insecure in like our own successes in our lives and we're looking to other people to measure ourselves and say like, okay, like what are they doing? What do they have? And am I where I should be? And so yeah. But another thing that could like positively or negatively impact our mental health is our social drivers, like our economic status. Do we even have access to like transportation, healthy foods? Do we have access to mental health care?
Yeah, the education part of it.
Exactly.
Definitely.
And I think that's like one of the great things that Reid has been focusing on is because like, yes, we have Richmond and yes, we have Connorsville, but we're also starting to branch out. And so like with, outpatient behavioral health, now we have like Cambridge City, we have Hagerstown, Brookville, like all of these smaller communities that may not have access. So,
and you mentioned isolation, and I know I have a friend, Laura Lee Heights, who's working as part of a grant and as a study on isolation, as well as that another part of, I believe there's actually monies attached because there's so many people that are feeling isolated.
Oh,
definitely.
Yeah, because like I think as we move more towards technology, we do tend to isolate. I mean, we have so many stressors. I mean, so many different obligations. We're at work, and we're trying to deal with all these like mini crises that we're having in our own personal lives, and sometimes we don't always have the energy to be socially active, but it's important
It's
for
very
our
important.
mental health to be socially active. And like loneliness, I'm glad that they're starting to address those things because, loneliness that has more of a impact on our physical health than smoking a pack of cigarettes every day.
Wow.
And so, when we think about going to our, doctor's visits and like, do you smoke? It's like, well, like, are you lonely? Because that's going to impact your physical health just as much.
And I notice now when you do go to the doctor, one of the questions they do ask, have you felt lonely? Just interacting with other people. So
That's
it's a huge deal.
Yeah, definitely.
What's some of the things specific to minority populations? And when I'm saying minority, like ethnic minority, LGBTQ, just various people regarding their mental health.
So, there are a lot of similarities, but a lot of differences too. Some of the things that minority populations deal with as far as like access to mental health care, like one is lack of insurance or even underinsurance. And so, the cost of health care is high, unfortunately. And because of that, if you don't have insurance, you may not have the ability to access that. Not everybody has that extra funding sitting around to say like, okay, like I can spend this on my mental health care, or even underinsurance. So say you do have insurance, but you just don't have enough insurance to cover the cost. So you're having to use some of your extra income for that. There's also just a like lack of diversity in mental health care providers. And so I know myself being a minority, whenever I go to see doctors, I want to see like providers that have similar experiences because like what's normal within our culture here within the US may not be like considered normal in, another place on earth. And so like wanting to have a provider that looks like you, understands what you're going through, is very important. So, and having that lack in mental health care makes people a little more hesitant to reach out. You also have just like a lack of cultural competence. So, even if people are open.
And I'm going to interrupt you. Explain cultural competency.
So cultural competency is all about having a general understanding of different cultures. And so, and And I know that providers are well-meaning, but, they have a lot on their plates too and may not always have the time to, brush up on every culture to make sure they're culturally competent. And so that makes people feel like a little more leery about reaching out. So we also have language barriers that come into play. Being a therapist myself, it's really hard to do therapy when you've got an interpreter trying to go back and forth between the two of you. So there's also just distrust in the health service, in health services in general. Our country doesn't have the greatest history on treating minorities well in the healthcare system. And so there's still some of that distrust there. We're also dealing with just mental illness stigma, and that's actually greater amongst our minority populations. There's a lack of knowledge or, different cultural perceptions. I know I was reading an article a few weeks ago, and they were talking about how minority populations are less likely to believe that genetics play a component in mental health. And so, there's more stigma related to, like if you don't believe that that's a component, then you believe that it's all within the person. And then another...
Sure. Also, people get afraid. So if it's part genetics, the other family members might say, oh, no, let's not. We're not accepting this because it could be me as well.
Yes. And then, so you see generations and generations of people not addressing their mental health because of that. But then we also just have like the lack of support in some of those safety net settings. So like when we're talking about safety net settings, we're talking about like programs like Medicaid. And so, yes, so like our people who don't have the financial means to address their mental health, they have Medicaid, but even Medicaid has its limitations. So like, I believe with like mental health therapy, Medicaid patients get 20 sessions a year. And so if you like really look at that, that's like one every 3 weeks. And, for some people, they need weekly mental health care.
Right. Another thing I didn't want to neglect often about religion and mental health.
Oh, definitely. That goes back to that cultural perception that we were talking about earlier. I know me and like my family growing up, in the Asian community, things like that are kept within the home. You don't talk to other people about your mental health struggles, or you go to your priest and you talk to your priest about your mental health struggles. And what I found is like, while those can be really great resources, they're not always trained to address those mental health issues. Right. And so, like you get a lot of, not with ill intention, but you get like pastors and priests who will say, we'll, pray on it. And it's like, well, we need to be more active in our mental health care and seek out people who have that specialty. And so, not to say that, spirituality is bad, because spirituality is also a part of our mental health too. Right. We just need to know like what resources to turn to whenever, and when it's appropriate.
And because people see that, I like to say that there's a doctor for everything, per se. And so if they're saying we can just pray about it, it's like, but there's physicians. So if you were having a heart attack, you're going to pray about it, but you're going to go see your heart doctor, so your cardiologist.
Exactly.
Exactly. So just trying to open minds with that. Do you feel like people talking about their mental health is becoming more common than it used to be?
Definitely. I feel like in some instances that may even be a conversation starter for some people. Referring back to the social media platform, you see this generation now where they feel like they have a story to tell. So they want to get out there and they want to publicize that, and other people seeing that brings a crowd of people in to say, hey, I'm going through that, I'm dealing with that, I would like to talk about that. So definitely I feel like mental health is definitely increasing the conversation a lot more than it was even 5 years ago, I would say.
And I definitely see, like, in our younger population, and I'm so grateful for this, like, you know, we're looking at Gen Z and Gen Alpha and, like, these younger generations, and they're saying, like, I want to focus on my mental health. Like, I want to be a completely healthy person. And it's great because, like, and that's one of the things that I do love about social media is that, you know, we're opening discussions where, you know, people are sharing about themselves and they're allowing themselves to be vulnerable about their mental health, and people are connecting with that. And they're saying, like, oh, I struggle with that too.
Right.
You know, I can't tell you the number of, like, TikToks I get sent, you know, just asking, like, is this true? Like, I think I might have this. So, and even when patients come in, they'll, like, show me, like, videos, and they're like, I want you to watch this for a second and tell me if this is me. So, like, you know, so it's opening those discussions. I mean, of course, like, with technology, I mean, like Trina was saying earlier, it has its negatives
Yes,
and its
pros and cons,
positives,
definitely.
but it has definitely opened up that discussion.
So what are some of the things we can control as far as our mental health?
So things that we can control when it comes to our mental health, like first, whether or not you're reaching out to, you know, your primary care provider, that's like a great place to start. You know, are you being active in reaching out? Other things we can control is our self-care habits, you know, like, are you eating healthy, staying hydrated, are you staying physically active? Those things that your doctor talks to you about. Other things that we control are like the activities that we engage in, you know, like, what are you doing on your free time? Like, you know, are you just doom scrolling through, like, social media, or are you out there engaged, getting active? Other things that we can control is our mindset, making sure that we keep a positive mindset, because, like, when you have that more negative mindset, unfortunately, you're more prone to seeing the negative rather than the positive, which will make things feel a little less hopeful. And just like I had mentioned earlier, like the resources we turn to, those are things that we could control. What information are we getting? Who are we turning to? Is that a credible source for mental health treatment?
Right.
Yeah.
And I noticed when I'm in the car a lot. And I've listened to this one person on the radio, and when they open up their show, they do a thing of just mindful breathing.
Oh, I love
Breathe
that.
in, breathe out.
Yes.
Yeah.
And I've caught myself now, even if I'm not listening to that, I know I'm like, breathe in, breathe out. And do this. So,
I love that though, because it's like, again, like, it's teaching us coping skills without, like, being like, hey, I'm teaching you a coping skill, right? So, like, I love the fact that they're thinking about those, because it helps us kind of recenter and reset. So
yes,
that's
yes.
fantastic.
We're not going to say how many times I've listened to the show and didn't do that. But after a while, I said, maybe that's what I'm supposed to do.
Love it.
So what are some suggestions you have that for somebody that feels like they're struggling with their mental health?
So, so kind of like what I had just mentioned. So reach out to your doctor, reach out to your primary care provider, make sure you're sharing what you're going through. If you have a mental health care provider, reach out to them. Make sure that you're also reaching out to your support system, like our family and our friends. Like, they can be a good jumping off point to say, like, hey, you really need to, like, go see your doctor, you know, because sometimes our support system holds us accountable. You can join affinity groups. And so affinity groups are people who, like, have, like, a common identity. So, you know, like, joining a group that, you know, you all share, like, the same ethnicity, or joining a group that's, like, LGBTQ+. You can also engage in some mood boosters, so things that will help you improve your mood, address your basic needs, so taking care of your hygiene, taking care of our bodies, making sure that we're processing our feelings, because feelings aren't good or bad. Feelings are just feelings, and we need to make sure that we're acknowledging those, processing those, working through those. Volunteering, doing acts of kindness, that always helps. I don't know about y'all, but I always feel good after I volunteer. doing some problem solving. So especially like if we have certain stressors in our lives, like being able to focus on it and say, okay, like I'm going to really think about this problem, come up with some solutions, and figure out what's going to be best for me. Learning some healthy coping skills, like some relaxation techniques, and asking for help is a big one.
It's a huge one.
Like I said earlier, like texting a friend, calling your family, like even reaching out to like your local mental health agencies, reaching out to your doctor, even calling those crisis lines if you need to. So like 988, we think about is the new number for the suicide hotline, and we think about it as a suicide hotline, but it's also a crisis hotline too. And so asking for help is a great way to just kind of move towards treatment and improving our mental health.
When you were talking on 988, I've worked with a group that has been part of working with the national 988 numbers. And they anticipated when they first started up 988, just a small, not a small amount, but the amount of phone calls that they received was just incredible.
Oh yeah, I was gonna say we are definitely in an age where our mental health isn't what it used to be, and so I'm not surprised at all that they're getting that number of calls.
And what are some quick things or simple things we could do to improve our mental health?
Relaxation techniques, like you mentioned earlier, Sherry, the breathing, those things that something that personally I think helps me, and people probably do it all the time, is daily affirmations. Having a conversation with yourself at the beginning of your day, setting the tone for your day by saying it's going to be a great day. I'm happy. You know, I'm going to have a good day. I'm excited. I'm a beautiful person. Like giving yourself those affirmations really help. Also, you know, people find themselves being in a way and being upset or being angry, and get active. You know, sometimes we feel lonely or sad. We kind of just want to sit there. Get up and be active. Go for a walk. I love watching funny videos. Go to YouTube and that's one of the mood boosters, right? Doing things of that nature. So things that'll make you feel good, that'll get you out active, that'll get you away from that space that you're in will be helpful.
Great. Well, we want to thank both Barbie and Trina for joining us today. And how can we get in touch with you?
So you can call Reid Outpatient Behavioral Health. If you are wanting to reach out to our Richmond office, the number to that is 765-983-3298. And then we also have a Connorsville location. And unfortunately,
I'm trying to think of that
phone number.
We'll get there.
Okay, I'm trying to think of it too.
I appreciate that.
Well, we want to thank you very much for joining us today on Let's Talk Together. And thank you.
Let's shine by seeing the best in all of us and by treating you here, right in your hometown. Let's look out for each other. Let's stay healthy. Let's shine together.